we know that PrEP is a right now very expensive preventative measure. We need to make sure it is affordable and a part of health insurance for all Americans. First of all, I had a moment when I was on the debate stage last where I was standing there and saw to my right an incredible woman, Amy Klobuchar, who was an incredible leader in our country. To my left was Mayor Pete Buttigieg, and I was standing in the middle, and I'm thinking to myself, as the debate's going on, you know, I don't know if my parents could have imagined a day when on a debate stage as major candidates, an African American standing next to an incredible woman leader and an out gay candidate. It's been an extraordinary election for showing what America looks like and what the future leadership will be as we become a more inclusive country. And tonight's forum is not lost on me. To my understanding, this is the first ever major LGBTQ forum based on LGBTQ issues in the history of our country. It is a profound moment of historical advance, but we still have a long way to go. As I said from the stage, we have tremendous problems with targeted violence against the LGBTQ community, disproportionate discrimination that we see from the healthcare system all the way to our prisons and jails with disproportionate incarceration of LGBTQ Americans. There's an urgency right now that I believe we cannot wait for change. And I'm very happy that many of these issues are actually being brought more into the public conversation today. And I will continue to talk about them, as I have from the debate stage, talking about violence against transgender African American women. That's just unacceptable. So with that, I want to say thank you.
Thank you. I've got a question for you. As the next president of the United States will represent over 1 million people, like myself,
New Jersey?
Yeah, it is. It's authentic New Jersey.
I thought so. I thought so. South.
Very southeast. Yeah. There's over 1 million people living in America with HIV. I'm one of them. The next president will have to fund resources for the 40,000 newly diagnosed HIV people in this country every year. What would you and your administration, what is your HIV policy? And also in tackling stigma and getting the important message like U equals U undetectable equals untransmittable out into the public so it's digestible for all?
Well, I talked about it actually a lot from the stage because I see this as an ongoing crisis. And remember, it disproportionately now is impacting communities of color, which have some of the highest rising rates. And it's something that we have to deal with. Over 1 million Americans, well over 1 million Americans now are HIV positive. And this is something we have to deal with. And so there's multiple approaches that we're going to have. Number one, stopping all the ways in which discrimination exists right now, legal discrimination against people with HIV or AIDS. Number two, it makes sure that we are expanding health coverage in key areas from Medicaid to stopping the attacks on the Affordable Care Act, which are all undermining access to people with HIV to getting the treatment they need. It means expanding the programs we know work, like Ryan White funding and funding for housing, supportive housing, and more. And it also means making sure we're doing two other key things. One is we know that PrEP is a right now very expensive preventative measure. We need to make sure it is affordable and a part of health insurance for all Americans. And then finally, we need to start talking about sex ed in our schools, science-based sexual education that talks openly about STIs and the important steps we can take to prevent their spread.
Yeah, getting the U equals U message out into the public.
Absolutely.